So let's talk about flaps for breast reconstruction. What if you're not a candidate for a DIEP flap, you know, the one that comes from the tummy down in the lower abdomen? We've got other options. Inner thigh, tug flap, horizontal skin island, VUG flap, vertical skin island, even the outer thigh, what we call the ALT, anterolateral thigh flap. Some women don't mind that vertical scar out there. It can give us a good amount of tissue. And then there's the PAP flap. That comes from the back of the thigh. So from the thigh, we've got 3 or 4 flaps right off the bat we can use in place of the DIEP flap. Then there's the old tried and true gap flap. And those are really a set of 2 flaps. Either the lower comes from the lower gluteal or buttock area, or the superior or upper gluteal area, the S-gap flap. Again, long-standing tried and true flap. And then there's really the ultimate long-standing tried and true flap, and that's the latissimus flap. Now, with the latissimus flap, you're sacrificing what we think of as a functioning muscle, the latissimus muscle. So from my own standpoint, if a patient has the tissue in the thigh region, inner thigh, outer thigh, back of the thigh, places I mentioned, we would go to those options first. But if those aren't available, you're too thin, maybe the lat flap or the lat plus an implant is an option. But don't despair. If you're not a candidate for the DIEP flap, maybe you've had a DIEP flap, that's very common in our practice, and then a patient comes back later and they need another reconstruction on the other breast, or you're too thin, too many abdominal operations, we've got other options, we've got you covered.